everybody. My name is Marie Kilduff, Director of the National Clinical Leadership Centre for Nursing and Midwifery, Office of the Nursing and Midwifery Services Director in the HSC. You're extremely welcome to our 8th webinar, and this webinar is titled Nursing and Midwifery Clinical Leadership During COVID-19, Sharing the Learning from Children's Nursing Services. I would just like to take a moment to remember our friend and colleague, Ms. Susanna Byrne, NMPDU Director, Dublin Kildare Wicklow. Susanna passed away sadly in December 2020, and many of you listening here today will have known Susanna. As this is a children's nursing and leadership webinar, it is fitting that we pay tribute to Susanna, who was dedicated to children's nursing and contributed significantly to the development of the discipline during the course of her career. From a leadership perspective, Susanna was a sincere, compassionate and authentic leader who led by example by her inclusive, empowering engagement with everybody, regardless of their title or role. It was an honour for us all to have worked with Susanna and, more importantly, to have known her as a wonderful colleague and friend. May Susanna rest in peace. I'm now going to introduce our panel today for the Children's Nursing webinar. Our panellists are Ms. Tracy Wall, Acting Chief Director of Nursing, Children's Health Ireland, Ms. Yvonne O'Connor, AMP in Paediatric Ambulatory Care, University Hospital Waterford, Ms. Doris O'Toole, Clinical Placement Coordinator, Children's Health Ireland at Temple Street, and Ms. Aisling Keogh, Assistant Director of Public Health Nursing, Nurse Practice Development Coordinator, Dublin North West. And I'm going to start today with Tracy, and as I said, Tracy is the Acting Chief Director of Nursing, Children's Health Ireland. You're extremely welcome here today, Tracy. And my first question to you really is, could you just tell me about your experience of managing your service during COVID-19?
Sure, thanks Marie, and thanks for the opportunity to be here today and to talk about, I suppose, the last 12 months and the impact of COVID-19 on children's services in CHI and amongst all the nurses that work there. So I'm very grateful for the opportunity. I suppose as I reflect over the last 12 months, it certainly has been somewhat of a roller coaster for us all. The experience that we had was very different to anything that I've ever experienced in my professional career, for sure. And when you think about March 2020, this was a novel virus. There was little known about it, to be honest. And we didn't really know the impact that it was going to have on children and those children who we care for in CHI. So we were anxious for sure as a profession and as a team. We looked across any sort of international evidence that we could gain access to see what was the impact in children and could we learn anything, particularly from what we had seen in China or Italy at that particular time was emerging as somewhere where the virus had seriously taken hold. And whilst we knew that the impact on children from those countries was much more reduced than it was in adults, it certainly didn't make things any easier for us. Albeit that we didn't have the experience that our adult colleagues had, in particularly around emergencies departments and their intensive care units and the volume of patients that we were seeing. Our experience was different, but nevertheless, although the numbers of children infected were low, we actually found ourselves using quite a lot of PPE because the signs and symptoms of many childhood diseases of a high temperature, a cough, the diarrhea, vomiting, all of that aspect of COVID-19, that is signs and symptoms of children that present to our emergency departments all of the time. So while our numbers were low, we did find ourselves streaming patients in our emergency department, having to identify a paediatric ward and a children's ward, potentially for patients who had COVID-19 or were query COVID-19. So So that was a big part of what we did, and we continue to do. For us, as I reflect, one of the biggest pieces was around our philosophy as children's nurses around family-centred care, and that when we care for a child, we embrace the family. And we couldn't do that because we had to reduce our visiting to just one single parent or one guardian. And that was very difficult for us as children's nurses. That was really, really hard. Managing the footfall in the hospital was huge at the time because every adult could be a potential COVID case. So we had a lot of work to do around supporting families and caring for children without that family unit being a big part of what we did, which was difficult. In terms of the complexity of the patients that we have, a lot of children who attend CHI have complex needs, and many of them are cared for at home in the environment with their parents or home nurses or home carers. And we just didn't know how the virus would impact on these children. So that was a real concern for us, to try and stretch out to the community and make sure those children were okay, and that we were doing as much as we could to support them. I think from a staff perspective, we all know that nursing is a predominantly female profession, and we have quite a young workforce in CHI. So we had many colleagues who were pregnant at the time and were concerned about being pregnant and you know, the exposure of COVID. We have a young workforce who have young children, and when the schools closed and children couldn't go to school, it was a real concern for staff as to how am I going to get to work and how am I going to have my children cared for. And I suppose the attitude that we took in CHI, certainly I was the Director of Nursing at the time in CHI Crumlin, was to be honest with staff. And we did a huge amount of communication with our nursing teams. We had daily sessions, certainly in the first couple of months, where myself and the infection control ADON would just have 30-minute sessions with staff to say, this is what's happening now, this is what we expect to happen, because things were changing very, very fast. And that was difficult for staff as well, because one day it was this message and the next day it was another message. So we tried to embrace face-to-face communication as much as was safe with social distancing and all of that piece. But I think that actually worked for us, and for many of our staff that were really concerned about that whole childcare piece. We tried to adapt the approach of, don't tell us what you can do, don't tell us what you can't do, tell us what you can do. And that meant that many staff did different things with their hours. They started earlier, or they finished later, or you know, they pushed things into the weekend if they could, where you know, their partner or their spouse would be at home to care for the children. So that was really, really important for us. I suppose the other piece of that affected children, and it's really, we've really seen it in about the last 7 to 8 months, and that's the impact on children's mental health. The presentations that we are seeing currently, and certainly in the latter part of 2020, have increased. In one of our sites, if we compare the presentations of children with mental illness in 2019 versus 2020, has increased by about 45%. So we know that our children and our young people are struggling because we've removed so much of what is normal to them. Going to school every day, traveling on the bus, walking home with their peers, you know, their sport, their piano, whatever it is that they do. It's reducing all of the time in terms of their peer support. And we're certainly seeing an increase in presentations with children who are just finding the whole thing difficult. Another piece that has really impacted us is just children who are presenting with eating disorders as well. That has tripled in comparison to our numbers in 2018 and 2019. And it's having a huge impact on children who need our care and who are presenting to acute hospital settings because they're struggling, and we need to support them. So all of that is very challenging, Marie, to be honest. And I think if you look at the team of nurses, certainly that I work with every day, I think we've all had periods where we're okay. And we're saying, you know, this is good, the vaccine is coming, you know, we're getting more information the end of April or the middle of the summer or whatever has been for the last couple of months. And you're good and you're fine and you support your colleagues. And then there's times when you mightn't be fine, and you might feel a little bit low and you depend on your colleague to keep you going. And that has been really important to us as nurses, as a profession, that we've been there to actually support each other and look after each other through this, because it has been really, really difficult.
Tracy, what I'm really hearing is, yes, it's been immensely challenging for everybody in your service, and you know, it is commendable how well you've supported the staff. And I'm just wondering, I'm sure our listeners are wondering as well, how are the staff coping at this time and how are they managing?
Yeah, I mean, I think, as I said there, I think we've all kind of had our being okay, and then being a little bit flat, as I would call it. But I'm extremely proud of the people that I'm surrounded by every day. Extremely proud of the clinical leadership that I have seen during this period of time. I mean, certainly in my career, I don't ever recall my daily work filtering into my home life. And I think that that has been a big challenge for us all, because we spend our days talking about appropriate PPE, washing our hands, you know, social distancing, observing signs and symptoms of every patient, of every staff member, of every family member. You know, have you got a temperature? Is that a cough I hear? And then when you wash your hands and you take your uniform off and you go home, it's very similar, because you know you're in Tesco with your mask on, and you know you're monitoring your family, and the people you live with, the people you care about, your friends, are they well? You're looking for signs and symptoms in relation to anybody, even in yourself, and then you turn the telly and it's about COVID, and it's about the COVID numbers, and it's about, you know, everything that you talked about during the day. So it's been really, really hard for people. And nursing is a challenging role, because you have to give a lot of yourself every day when you're caring for people. And then when you come home, I suppose in a time of a pandemic, many family members are looking to you for the answers and looking to you for the reassurance that everything is going to be okay. So I think that that has been hard for people, to be honest. I think that certainly what I've seen over the last year is colleagues who have literally shone, people who have been leaders within their own teams at ward level or within a department, and not always the people who you expected to lead. We've certainly seen, and I've certainly seen, some very quiet, confident individuals who have just flourished and come to the top and have done the simplest things amongst teams. The quiet cup of coffee, you know, the ward or department newsletter, you know, the small little things that have made a big difference for people. And I want to commend people for that, because we haven't just looked to the senior leaders during this pandemic. We looked to everyone that we work with to get us through the day, or to give us that little bit of hope, or give us that little bit of a laugh when we need it. And I've certainly seen that in abundance with my colleagues in CHI, for sure.
And it's really positive to hear that, Tracy. And definitely, I have heard it said that some of the quieter leaders have come to the fore during this pandemic, which is brilliant. And as leaders ourselves, it's to try and encourage that. And I suppose I'm just thinking, you've alluded to some of the changes that have happened in your service due to the pandemic. And there's been a lot of positive things, even though it's been a really, really challenging time. And I'm just wondering, could you tell us about some of the changes that you would say we'll keep this after, when this day comes and we're out of this COVID-19 situation? What changes would you say will stay to benefit your service from the learning from COVID?
Yeah, Marie, that's a great question, because we do want to look to the positive, you know, we really do. So I think one of the obvious things is the virtual world that we've literally just leapt into, for sure. And certainly from my own experience in management and leadership, this virtual platform that we have. Look at us today in terms of what we're achieving. But it certainly allowed me to be in many different rooms, in many different forums, because I can move from a Teams call to a Zoom call to a WebEx call, and partake and be at the table in many forums that it's appropriate for me to be at. And that's been really helpful and really beneficial from a time perspective and an engagement perspective. I think from an educational perspective, the virtual world has absolutely opened up so many opportunities for us. And I'm very proud of certainly what I've seen demonstrated in CHI amongst clinical nurse education facilitators, CNSs, A&Ps in particular. And very quickly they mobilised, and with the support of the CCNE in CHI, stood up education programmes very quickly and very confidently. And things like resuscitation training, child protection training, things that you thought you had to be in the room for, suddenly there is a virtual component that makes a big difference, and we can still keep that education platform alive for all of us, because we all need education. So that has been really impressive, and I don't think that that's going to go away. I think the future post-pandemic will be a blend of both face-to-face and a blend of virtual teaching for sure. And then finally, from the clinical side of things, what I've seen from, again, a lot of CNSs in the service have put their hearts and minds into this, and that's to try and engage with families. I talked at the start about that family centred care piece, and with only one parent in the hospital setting, and that was very difficult. And I've seen my CNS colleagues do amazing things with WhatsApp calls and, to engage the other part of the parenthood, or even with parents and families fearful of coming to an acute hospital setting for an appointment. The virtual outpatient clinics that were stood up again very quickly, and not with the best of technology. We certainly haven't got the best platforms, but huge credit to my CNS and A&P colleagues who were able to do as much as they could, working obviously in tandem with the clinicians, but to continue with so many outpatient appointments and continue to see patients in a virtual world and give that assurance to families, you're okay, everything will be fine, was really important. And again, my own view would be that the future is a blend of this virtual world and coming to an outpatient clinic. And I suppose, Marie, if you look at the family unit, again, the amount of sacrifice that a family has to make to bring a child to the regional hospital or to CHI, the logistics of that are huge. It usually involves other siblings, granny or granddad stepping in to collect children from school, a neighbour, a car journey, parking. So if our future is a blend where we can do that from home and the child doesn't have to miss school, and the other siblings, it's not too much taken out of their lives. If we can do that, I think that will be a major step forward in terms of how we look after children and their families in the future. And certainly with our new children's hospital, we are very excited about it, and we're dying for it to happen. But if we continue with the roadmap of every child that has a complex need and needs to go to a regional site or a local site, or indeed travel up to the new children's hospital in Dublin, that isn't what Sláintecare is about. So this virtual world that has been created out of the pandemic, I believe, is giving us the foundations to stretch to the community and to reach into primary care in a big way for children and their families.
Tracy, I just think by what you've just presented there, just creates so many positive aspects out of the negative experience of COVID. And in some ways, it has been said in other webinars of ours that, you know, Sláinte Care has almost been accelerated in some ways in terms of preparing for it by our experience of the pandemic. And just even the quality of life for patients and families is just so important for your children and their family, siblings, etc. So it's wonderful. I also hear an awful lot of adaptive leadership in there from your staff and teams, and collective leadership too, which is admirable and really has contributed to the successful outcomes. I suppose a final and important question I'm going to ask you, and it's probably more of a statement than a question. Tracy, you know, we are coming out, please God, we're coming out of the third wave. This webinar was to be recorded in January, as you know, and we had to cancel due to the impact of the third wave. It's been really, really difficult and really challenging, and you yourself have moved into a new role since then in terms of the acting. I know you've been doing it for a long period now, a couple of months, but you're in the acting Chief Director of Nursing. So you're in a prime position to deliver a message to all of our colleagues listening in terms of children's nursing. What message would you like to give them today now that you've got this opportunity?
Yeah, thanks, Marie. I mean, there's no question I work with amazing people. So there's a lot of amazing people in children's nursing, not just in CHI, throughout the country. And I'm very proud to be part of that profession. So what message would I like to give? I had a conversation with a colleague recently, and we were talking about the pandemic, and we were talking about, you know, how the last 12 months has been. And one question she asked me was in relation to decision making, and particularly, I suppose, with the acting role that I'm currently in. And, you know, how are you comfortable when you go home in the evening, given, I suppose, the level of decision making that's required as a nurse? Be it a staff nurse with your patient, you're making clinical decisions all of the time, right up to the position that I hold now. And I suppose I gave her this advice, and maybe it might help somebody in their everyday work. And I suppose often when I leave work, I do reflect on the decisions that I've made that day. And when I know 3 things about the decision that I've made, I'm comfortable with it. And what are those 3 things? So the first thing is whatever decision I've made that day, did I make it with good intention? So good intention about the patient, about the patient's family, about nursing, about the nursing service. And if the answer to that is yes, then I ask myself a second question. And that is in relation to the decisions that I made that day, did I make them with kindness? And I know that might sound a little bit simple, if you like, but I think it's very important in the environment that we work in. So what do I mean by that? I mean, when I made a decision, because not all decisions you make will be what people want to hear. So if you had to do a face-to-face conversation with somebody, did you do that? And did you do that with kindness? If it was a letter, if it was an email, you know, was there an element of kindness in your discussion, in your writing? And if the answer to that is yes, I feel better about the decision I've made. And then finally, and probably the most important, is that did I lean on all of the experience that I have? I've been in a management and leadership role now for a long time. And, you know, I've learned a lot throughout the years, through mistakes as well as successes. And did I lean on all of my experience when I made that decision today? And did I look for evidence to make sure that I was using the right evidence to make that decision? And if I say yes to those 3 things, and if I come to work the next day, and if somebody feels that my decision was incorrect or could have been different, I suppose, Marie, I know that I did my best at the time. And I think that would be my message for everybody. You know, have good intention, have a thread of kindness to what you do, and use your experience in the decisions that you make. And if everybody was to do that, I think we'd make some pretty good decisions.
Tracy, that's a wonderful message. Thank you so much, because it's so practical and it's drawing on one of the key leadership competencies required to be a leader, your decision making. So I think I certainly will definitely use that myself, and I'm sure many of our listeners will. Thanks so much for taking the time to join us today, and thank you for being so honest and informative about your experience during COVID-19.
Thanks, Marie. Thanks for the opportunity.
I'm now going to move on to our second panellist, Miss Yvonne O'Connor, and Yvonne is an AMP in Paediatric Ambulatory Care. And Yvonne, I'd just be really interested, first of all, because it's a unique role, and I think you're the only AMP in Paediatric Ambulatory Care in Ireland. I just would be interested to hear a little bit about your role as a starting point.
Hi, Marie. Listen, firstly, thank you for asking me to join this. It's great. The role really came about because we saw a huge service need, that we saw an awful lot of children presenting to an acute environment with very much OPD complaints, either to expedite an OPD appointment or just to gain a bit more treatment because it's just not being able to be managed in the community. And that's where we saw, I suppose, off the back of the National Clinical Programme as well, so treating the child as close to home as possible, and trying to keep well children out of the acute environment. So ambulatory care is a child, or paediatric ambulatory care is children that do not require hospitalisation. So I undertook the course, and I'm an AMP since 2010 here in Waterford. I very much work from an outpatient point of view. I see children from 0 to 16 years of age with numerous complaints, but an awful lot of the children I see are atopic, so a bit of asthma, eczema, allergies, constipation. But if I'm in outpatients, I can see anything that the GP sends our way. I'm very much, as I said, an outpatient, but I do ward consults and I do a PEDS assessment consult, and of late I'm using a clinic out in primary care to assess a lot of children and see children. So yeah, it's a very good variety of children, and it's a great role. I love it. And yes, I'm the first in Ireland, but I do hope that the vision is to have loads of AMPs in paediatric ambulatory care.
And Yvonne, it just sounds like such an interesting and necessary role. And I think I'm just wondering, in the past year, I have no doubt the pandemic impacted on your role, and I'm just interested to hear, how did it actually affect your role as you tried to navigate your way through COVID-19?
Yeah, I think it had a huge impact at the very start this time last year. Like Tracy said, you know, we all knew it was coming. We didn't really know how it was going to impact us. And then from an outpatient point of view, it was very different to the hospital as well. So my biggest challenges I faced was that I couldn't assess anybody. I couldn't see children. Yes, we were ringing patients, but our assessment was based on a parent's assessment of how unwell the child was, or were they getting any better? What was our treatment working, or was it not working, which was very, very difficult. You'd parents at home worried if they contracted COVID-19, what would happen with their child with a chronic illness. You've children that did contract COVID-19 and they were at home and they were afraid to come to hospital. There was just an awful lot of fear within. And then how can we support that, being in the bubble in hospital? How do we get that support out to the community, to the parents? And then our next challenge was when we started to open back up again, of children going back to school. Parents were in fear. Do we send them back? Children with chronic illnesses like asthma, can they wear the mask? Will they last in school all day with the mask? What if they cough in school? Then you had schools that didn't really know how to manage this as well. So it was just very much the unknown and how we could support that. And then, as Tracy said, we had so many children that had symptoms like COVID, but wasn't COVID, and it was normal childhood illnesses, and trying to tease that all out and, I suppose, reassure parents an awful lot. Because I think I found in my role, a lot of parents felt alone, that if they did have a child that was unwell, they couldn't take them anywhere. Nobody wanted to see them. They couldn't go to hospital, and they didn't want to come to hospital. The GPs very much was doing a phone assessment. We were doing phone assessments, and again, it was an awful lot of responsibility back on the parent. So I found that hugely challenging.
And obviously, I just think, Yvonne, as a parent myself, having somebody like yourself to be able to link in with would have been just so reassuring, I'm sure, for so many parents, you know, who just, as you said, it was such an uncertain time. And during the pandemic, you've mentioned a couple of things there that were done, but maybe just for our listeners, could you give us one or two examples of some initiatives that you were involved in during the pandemic?
Yeah, so the first big thing I had huge challenge with was supporting parents at home or seeing new patients that needed to be seen, but again, over the phone. So there was a new platform, T-Pro, that they brought into University Hospital Waterford that very much dealt with dictation, but you could actually do a virtual clinic with. So it was a virtual text or an email then sent to the parents. They go into a virtual waiting room, and then I have a clinic. So basically I see all these, like a Zoom call with the parents and with the child. And I found this hugely beneficial, that I could see a parent, I could see the child, albeit you're not putting a stethoscope to a chest, or you're not feeling a tummy, but you're seeing the patient. I could see their skin, I could see a peak flow. I'm getting a bigger picture of what's going on, and then basing my treatment on that. And it takes the responsibility out of the parent that just wants some help. And I found that hugely beneficial. And I rolled it out first here in the department, and now everybody has followed me on and taken on, because it's just a huge beneficial service that we have here. And the other then was that I always felt that my role would be very much pushed into primary care. I feel that's where I sit better and I serve better. So I availed of some rooms out there, so that if I needed to see a patient, I could then see them in a primary care setting, that they didn't have to go into a waiting room. They came straight in to see me. There was nobody waiting. There's no mixing of anybody. They saw me and then they left. This is very reassuring to a parent who's bringing a child in to be seen, that they weren't in a hospital environment, and it was very much as much away from COVID as we could. So that was hugely beneficial to my work and my role.
And Yvonne, just as you're talking there, what I'm really hearing is a little bit along the lines of Susanna Care, that integration, which is key to our future, and Tracy alluded to it as well. So in some ways, the experience during the pandemic, whilst it's been absolutely horrific, but there is some benefits in it that it's almost accelerated some of our preparation for Susanna Care going forward. And I suppose just for our listeners again, there's obviously been a lot of learning, Yvonne, for you and for your colleagues from initiatives that you brought in. Could you just tell us a little bit about the learning from COVID and how it will influence your role going forward?
Yeah, similar to Tracy, definitely virtual is a good thing. Like even in the last couple of weeks, kids have gone back to school, and I want to check in with them, make sure everything is going okay, or if they need to change their treatment, I can see them. We can do a call first thing in the morning before they go to school. Parents don't need to take time off work. They can go to school. And going forward, we don't want children missing school. They've done enough of that. They've missed enough of school. So just to make their day a little bit easier, I definitely will be keeping the virtual side of things going. And then absolutely, I can see my role flourishing in primary care. And to try and keep children out of hospital is the goal. And it always has been the goal, along with the National Clinical Programme, is just to keep the children that don't need to be in hospital out of hospital. And I do believe, even talking to parents and stuff, they feel more comfortable coming into a primary care setting. They don't want to come into hospital as much. So it's definitely a way forward, and definitely where we'll be. My next big project will be to push that a little bit more.
Yvonne, thank you so much. It's been a pleasure listening to you today, and your role is key, and it's fantastic to hear. It's so innovative, and especially during COVID, what you've done is fantastic. So thank you so much for taking the time to speak with us today.
Thanks for having me.
So our next panelist is Miss Doris O'Toole, who, as I said, is a clinical placement coordinator in Children's Health Ireland at Temple Street. Doris's submission for the webinar really caught our eye, because it was the development of a mental health wellbeing programme to support student nurses in clinical practice. And we just felt, as a panel assessing the submissions, that this is very, very important, particularly at this time during COVID. So Doris, you're very welcome. And I'm just going to ask you, for the purpose of the webinar and for our listeners, could you describe the background to this novel idea and why it was implemented into your organisation?
Yes, hi Marie. So the background to the program, so this program was developed, it's a mental health wellbeing program, which was developed back in 2019 as a pilot initiative for our integrated nursing students. And the reason for this program really was, I suppose, based on the clinical need from our students, and also the limitations within the curriculum as identified by the students in relation to mental health wellbeing education. And I suppose from a service level, really, we found that there was an increase in nursing students presenting with mental health difficulties in practice. So this was a concern for us. And with that, we developed a needs analysis back 2 years ago. And this involved our students both from second year and internship year, really to, I suppose, look at what the needs were of the students and ask students really what affected their mental health in practice. And equally, if there was a program available in relation to mental health wellbeing, what that would involve. So that was very much the starting point and a crucial piece really for me in terms of the wellbeing lead to see really what the students were actually looking for. So that program was rolled out, as I said, in November 2019 with our first year students, and that involved 6 hours of wellbeing workshops and also weekly debriefing sessions with the CPC.
And Doris, it was wonderful that it actually had started before COVID, because it gave you the time to get it well established and to have a look at how it would work. In March 2020, as we all know, COVID started in Ireland, it came to Ireland. And I'm just wondering I just think it would be really good to hear, how did you adapt the programme to support students during this challenging time?
Yeah, so it was a big change, I suppose, in the sense that we had a face-to-face workshop, a program delivery set up, and obviously with COVID, that had to be reassessed. There was two factors really. One was the students returning to placement. So we had our third and fourth years in particular coming back on placement after placement suspension. So with that, they had very different needs, I think, and we did a more informal needs analysis with that group. And what they had identified really was the level of anxiety, particularly the heightened anxiety they had with regard to coming back into a clinical environment where there were patients with COVID. And I suppose for them, really, the concern was becoming sick themselves from COVID, but particularly the fear of bringing the virus to their family and friends. So that was a real anxiety that they had. And I suppose as well, the other factor was just around the supports and resources available. They wanted to know more about what supports were available, where they could go to, who they could go to, and so on. So they were the key elements. So we developed a number of workshops around those particular topic areas and repeated those over a number of times, because again, we had to facilitate small numbers due to the restrictions. For our first year students in particular, they only arrived on placement 5 weeks ago. So they came on placement at a time again, which was much later than the normal for their group. And with that, we had rolled out, as I said, a face-to-face program back with our 2019 pilot. So we had to adapt that to a virtual format. So again, that took a lot of time, a lot of preparation, and thankfully, the evaluation from that has been very successful, but we did actually maintain the face-to-face debrief sessions, which I felt was really, really important, because again, with the debriefing sessions, it was important to have that, I think, social connection with the students, and also for them to have that element of social connectedness, which many of them commented on in terms of the social isolation they had as a result of COVID. So they were the main changes that we made as a result of COVID.
And Doris, I'm just hearing during this period, so much changed and so much happened, and it happened really at a pace. As the programme lead, it would be interesting to hear, how did you manage the difficulties that you experienced and overcome the challenges in trying to implement this programme during the pandemic?
Yeah, it was challenging because, again, as I said, there was a lot of students on placement, and students, as I said, had a huge amount of anxiety coming back to placement. So we had to manage that anxiety and, I suppose, listen to the students, listen to their fears, and really implement the programme to suit those needs. Again, the programme delivery was the workshops, which were mainly face-to-face initially for the initial pilot programme, but again, they were virtual now. So there was a lot of logistical planning. A lot of students students were out on external placement as well. So we try to ensure, I suppose, equity and accessibility for the students in terms of health promotion. But really, that was really, really challenging because we had to liaise with the external services, try and enable students to have access to the sessions, bearing in mind too that these sessions are not compulsory. So it was really to give them the option of attending these particular workshops. So there was a lot of logistics, but I mean, from a leadership perspective for myself, I suppose it was really the persistence in terms of knowing the benefit of this program, seeing the evaluations initially from the pilot program, and understanding that this was really, really important to address the needs of the students. So collaboration with the various personnel, both internally with our occupational health, with our clinical nurse specialists in mental health, with clinical psychology, and also we were very fortunate to liaise with external services, particularly Jigsaw and Shine, in terms of also providing support and feeding into the workshop delivery as well.
And Doris, I just think it's commendable that you had that tenacity to keep going with this, knowing how important it is during a time when you could have, prioritized other aspects of your role. I just think it's so important. And obviously from the feedback from speaking to you, it's been really welcomed by students, and indeed other staff have seen the value of it. There's been massive learning for you. I can hear it from speaking to you before and from today. And it would be interesting for our listeners to hear the key learning points. And I suppose one of the points that I feel is important to include is the inclusion of the external experts in this work. Because sometimes debriefing and that kind of work can bring up issues that we need to be able to hold and to manage. So to have that external expertise is key, and I know you're very aware of this yourself, and it would be good to hear that. So maybe just talk us through the learning from this experience.
Yeah, I think it has been a huge learning, and I think a learning for me as well as the program lead, and also learning from the students, because I think this program has to fit, and I think it has to fit the group that you're actually managing. So the needs analysis piece was hugely critical, I think, in terms of identifying what was needed as part of this program. But equally, I think having the relevant expertise and professionals involved in the delivery of the program is equally important. So I suppose I liaise with quite a number of people, both internally and externally, as you said. Having the input from Shine and Jigsaw, I think, was quite critical as well, because they have the expertise in terms of mental health and managing the supports around that. And I think it's important for the students as well was to differentiate really mental health and mental illness. And that was a real, a strong learning point as well. And that came across very, very well in the evaluations. And again, quite nicely, the way the students put it as well was what they took from this was where they felt that they needed to focus on what they could control as opposed to what they couldn't. And that came across quite clearly in the evaluation. So I thought that was a really good learning point. I suppose for me personally, and leading out in this program, I think just building up those relationships with the various personnel, because in terms of sustainability going forward, I think for this program, we need to have multi-stakeholder involvement, but equally, as I said, having the right people delivering the program. So that collaboration in terms of, I suppose, building capacity really, and also in terms of going forward with scalability, I think it's really important as well.
Doris, thank you so much. I just think, one of our aims in doing this webinar was to support shared learning. And I'm sure many of our listeners today will just be really interested in this initiative. I know you've published in the World of Irish Nursing, and you got a lot of interest after that last year. I also know you were shortlisted for the Healthcare Excellence Awards. So, I mean, it's a fantastic initiative. I'm conscious if people are listening and they'd like to contact Doris to get more information, you can certainly do so by coming through the NCLC, and we'll have our contact details at the end of the webinar. Doris, thank you so much.
Thank you.
And I'm delighted to introduce our fourth panellist today, Ms. Aisling Keogh, who's an Assistant Director of Public Health Nursing and the Nurse Practice Development Coordinator in Dublin North West. Aisling, you're extremely welcome. And my first question to you is, on your submission, Aisling, we were quite impressed by what you presented, which was an overview of the centralised mass immunisation programme, which was delivered for school-aged children within Dublin North City and County, and the involvement of the same. Could you just give us a brief overview of what this initiative involved?
Thank you, Marie. So in March 2020, under government directives, all schools closed in response to the emerging COVID-19 pandemic. And this resulted within Dublin North City and County Community Healthcare organisation that a large cohort of school-aged children who still required completion of the school-based immunisation programme for 2019-2020. And within Dublin North City and County CHO, it consists of 3 different areas: Dublin North, Dublin North West and Dublin North City. And it consisted of delivery of the MMR and the 4-in-1, which was still outstanding for a large number of junior infant students, and the delivery of the HPV, the second dose, and the main ACWI for the first year students. It resulted in approximately 7,500 school-aged children still requiring vaccination programmes to complete the 2019-2020 school-based year. Within DNCC, senior management requested from the Directors of Public Health Nursing a proposal in relation to how to recommence these clinics and achieve completion prior to September. And following on from this, it resulted in the proposal for a centralised mass immunisation programme, which was delivered in SOARS and within Dublin North City and County, which was very much so underpinned by a multidisciplinary, collaborative, team-based approach, consisting of administrative staff, of nursing staff, of senior area medical officers, security staff, HCAs and portering staff. And this collaborative team-based approach resulted in over 6,000 children being vaccinated over a 3.5 week period. In relation to nursing, it was under the clinical governance of Director of Public Health Nursing, Sean Cassidy.
So Aisling, as you presented that there was obviously a huge amount of preparation, planning and organisation to what you actually achieved. And just for our listeners to really hear, could you tell us how you led on planning and preparing for this implementation of the immunisation programme and really to ensure the successful delivery of vaccinations?
Thanks, Maria. A multifaceted approach was required in relation to planning and organising on various different levels across the organisation. Some of the key considerations initially for planning related to securing premises, looking at workforce planning, the necessary equipment that was required, looking at PPE recommendations and infection prevention control recommendations, conscious it was being delivered in the context of COVID-19, and the ordering of vaccinations, transportation and delivery to site was another key consideration, communication to parents, and the implementation of SwiftQ, and the vast amount of work that went on prior to commencement of the vaccination programme by administrative staff in relation to identifying the student cohort that required vaccinations and ensuring that all data was uploaded to SwiftQ to generate appointments, which was imperative to the overall success and running of the programme. And specifically in relation to nursing, we identified the skill mix in relation to the trained staff for the school immunisation teams who were available within the CHO. Conscious that this was being delivered over the summer months, and we required a large cohort of staff trained up to administer under protocol as outlined by the National Immunisation Office. This required vast communication and collaboration from the CNME and St. Ita's, from CIT, as the training for nurses to administer vaccines under protocol consists of 7 online HCLAN programs and 2 face-to-face training sessions. We also provided 1 further face-to-face training session which looked at the overview of the whole immunisation programme and how we would actually run it on the day. We went through injection technique and went through consent forms and actually administering vaccinations under consent in line with the national recommendations, went through roles and responsibilities, clinical governance and management of sharps, and any outstanding issues that staff raised or general concerns that they had on the day, which just which enhanced the implementation of the programme.
Aisling, that overview was so impressive in terms of the level of commitment and your decision-making skills and your planning, etc. But behind it all, as you mentioned yourself, was students and a patient, and the patient journey is so important. And I'm sure our listeners would be really interested to hear about the patient journey. Could you tell us a little bit about that through this process, because that's the most important part of this initiative?
Thanks, Marie. Yes, once students received their appointment via SwiftQ, and they arrived on site in Swords in the National Showgrounds, they were met by security staff who took their name and directed them towards parking or to the entrance of the facility. ensuring at all times that there was 2 metre distance were maintained in line with IPC recommendations. Upon entering the building, the first point of contact, the student and one accompanying adult was met by a nurse who asked COVID screening questions in relation to symptoms of COVID-19 or travel. If at this stage there was any concerns were voiced, we had a hub allocated directly behind the desk for one of the area medical officers who are on site and available at all times to address these concerns. If there was any signs or symptoms of COVID, the student and their accompanying adult were asked to leave the building, and then a follow-up appointment was arranged for them. If no concerns were voiced at this stage, they proceeded to the administration desk where they were booked in and their consent forms were given. They then proceeded, guided by security, down to the hubs where the vaccinations were delivered. Upon entering the hubs, on one side, they received their vaccinations under protocol and then proceeded over to the recovery area. In the recovery area, there were two recovery nurses and 3 area medical officers on site at all times to ensure the safety of the client in the event of any adverse reactions. All students and the accompanying adults spent 15 minutes in the recovery area prior to exiting the building through a separate exit, ensuring that there was a one-way system in place at all times.
Aisling, I suppose I was really struck when you were speaking to me there earlier around the support that was offered to students with additional needs. And I would really feel it would be beneficial for our listeners to hear about what supports you put in to really make the experience beneficial for this cohort.
Yes, Marie, we consulted with the occupational therapist within the area in relation to any students who attended with additional needs to see if there were any processes that we could put in place. Following on from their consultation, they recommended that we would provide headphones on site if anybody wished to use them, and they also provided us with any equipment that may be of assistance to any students with additional needs to enhance the journey through the immunisation centre. Additionally, we reduced any noise levels as well for students, and where possible, lighting was reduced in the actual hub that we deliver the immunisation for. I also escorted those children directly to one of the hubs, skipping any queues to ensure that they were seen as quickly as possible.
And I think what's really admirable, Aisling, is that you considered all aspects of what it would be like for either a junior infant or a first year student going in to get a vaccination in a mass vaccination centre. It was certainly extremely person-centred and admirable. I'd like to congratulate you and your colleagues on that. But I suppose we are, coming out of the third wave. Vaccinations have been postponed for these cohorts and they will be starting up again. And for our vaccinators who are listening, who are going to be vaccinating the school children, in relation to this initiative, what would you like to tell them in terms of your key learning from your experience that will help them as they embark on this initiative again?
Maria, I think the key thing in relation to the successful delivery of this programme was the planning prior to commencement of the programme, and the comprehensive planning in relation for nursing to staffing, to training needs analysis, to staff, to identifying the school vaccination nurses who have previous experience from it, allocation of a nurse to rostering both duty for staff members along with actually allocating each individual hub, because it was very important that each nurse was responsible for drawing up their own medications and in line with infection prevention control, that there was no crossover between hubs. Also, we allocated one of our CNSs for the immunisation team to the vaccinations and responsibility for maintaining the cold chain and distribution of vaccinations, which was excellent, as this was a key point of expertise and clinical advice and support available to all nurses within the hubs. It was also extremely important that we allocated any of our trained schools teams, nurses, to every third or fourth hub along the row, because this ensures that on the first day of training that any nurses who previously hadn't vaccinated, that they were observed doing it under observation by an expert and then were signed off as competent. So it just provided additional advice and support to all nurses on commencement of the programme on the day.
Aisling, I know we were speaking during the week, you were telling me about 2 priorities that were key to the success of this initiative. One being communication and the second being the interaction with the multidisciplinary team. I wonder, could you tell me a little bit about both of those priorities and how they influenced the success of the initiative?
Yes, communication and the multidisciplinary collaborative approach was absolutely core and fundamental to the overall running of this programme. Every morning we held a huddle on site for all staff members who were present on the morning and were rostered on for the day. And this outlined the process for the day and the flow for the day in relation to whether we would have first year students in or whether we would have junior infant students in. We allocated the hubs to everyone on site on the day, so all 20 nurses, ensuring that if there was an overlap between junior infants and first years, that we had individual hubs allocated to each to ensure that to reduce the risk that there was no medication errors. We also looked at what the overall plan was for the day and any learning from the previous day, which was extremely important. It was a brief huddle, it took no more than 10 minutes, but it was absolutely core and fundamental to the successful delivery of the programme during the day.
Aisling, I'd just like to thank you so much for presenting on this initiative. It was just amazing to think how successful it was. There was such an amount achieved in such a short period of time, and it's going to be really beneficial for those that are listening that will have to vaccinate school children in the coming year to make up for those that haven't been vaccinated during the pandemic. So thank you so much. I'd just like to take this opportunity to thank all of our panelists today. It's been fantastic to get the different perspectives for children's nursing. From Tracy as the Senior Director of Nursing, Chief Director of Nursing currently in the Children's Hospital Group, leading on to Yvonne, who spoke about her role as an advanced nurse practitioner and gave us insights into how she led out during COVID-19. Doris had a very different perspective in terms of supporting students and making sure that their mental health needs were met through the interventions that she initiated in the hospital. And also Aisling, who's just presented on her experience of leading on a mass vaccination centre to meet those needs of those school children that needed to be vaccinated and weren't due to COVID-19. I'd like to take this opportunity to thank you, the listeners, for listening to the webinar today. Our next webinar will be our final webinar, where we will take time to reflect on all of the clinical leadership experiences that we've heard during the course of the series, from all the different disciplines of nursing and from our midwifery colleagues. I look forward to presenting that webinar. The date hasn't been finalised as yet as to when that will take place, but we are hoping to circulate it in the coming months. Thank you.